It's Shadow Day, baby. For those of you who don't know me, my name is Gabe. I'm a pre-medical student, and I'm hoping to go to med school in the next coming years. Medicine has been my entire life since I was a child. It's all I've ever wanted to do. And I am shadowing a physician for the next 48 hours. Now, specifically, I'm shadowing a neurosurgeon at a level 1 trauma center for 48 hours. Now, that may sound like jibber jabber to someone who doesn't know much about medicine, but I'm gonna break it down for you. Breaking it down for you, a neurosurgeon is a physician, a subspecialty that focuses on illnesses and pathologies of the brain and the spinal cord. A level 1 trauma center is a hospital center that focuses on the highest acuity level of patients. So the most sick and the most hurt patients go to that hospital. The most life-threatening injuries go to that hospital. You may see in the movies a helicopter comes down into the hospital and they all rush into the bay to attend to the patient. That's the hospital where I'm going to be shadowing at. I've got my scrubs on. I've got my scrub cap. I pray for all the patients that I'm going to encounter, but the selfishness in me really wants to see something bad so I can really immerse myself into the field and really understand the stress and the rigor that comes with being a neurosurgeon on call. I shadowed the same neurosurgeon a couple months back, but this was in the clinic. So I saw a lot of pre-op and post-op patients, and I didn't really get a sense of the acuity of these illnesses and of these pathologies. So I contacted that physician and I said, hey, can I shadow you on call so I get a real glimpse of what it's like to save lives? And that's what I'm doing the next 48 hours. There's something so peaceful about waking up and it's still dark out. You know, I see all the trees, all the lights. It's humbling and gets me energized, gets me ready for the day. You know, it feels good to wake up this early in the morning knowing you're about to do some good. And that's what I try to tell myself every day. You're waking up and you're going to do good for the society. That should be everyone's goal, to do something good for society. And I think waking up in the morning, early in the morning, getting your morning started correctly and right, and telling yourself you're going to do something good today. I think that is what makes good physicians, good nurses, good in any profession, a good person. Just put on the shoes that complement the scrubs nicely. Scrub cap, wallet, keys. Let's go. Again, there's something so peaceful about driving and waking up when it's still dark out. It makes you feel like you're going to accomplish something big. You're waking up earlier than everyone else. You're starting your day earlier than everyone else, and you're successfully you're going to be more successful than everyone else. I'll show you guys the sunrise when it happens. It's going to be beautiful. But I'm on the way to the hospital. Like I said, it's an hour drive, so it's going to be a little while before I get there. But once I get there, I will show you guys the hospital. I'll show you guys what it looks like, and we'll take it from there. Hey everyone, I was told I can't film in the hospital around the wards or anything, so I thought I would instead come into the stairwell of the hospital after some of the patients I see, after rounds, after surgery, and I'll give you kind of an update. And I can't share too much information because of HIPAA regulations, but I thought I'd give you guys an update on what I've seen so far. All right, everyone, rounds are done. Morning rounds are done, at least. I saw a couple patients, but I'm going to pick the few that really stood out to me. First patient we saw during rounds was a 57-year-old gentleman who had been in a motor vehicle accident. He crashed his motorcycle. Two key variables in that, though, were that he was severely intoxicated and he wasn't wearing a helmet. So among other injuries, like he had chest tubes in when I saw him, he had contusions all over his body. He had a crush injury, a blown injury to his spine. And it was compressing on the spinal canal. And that's what it looked like after getting the images of the spine and the neck. So he was intubated when I saw him. Huge hematoma on his right eye.
But yeah, he was initially believed to be paralyzed, but today during rounds, he showed some movement in his limbs. Even though he's intubated and not really responsive, he showed some movement in his limbs when stimulated, and so that's a good thing, a pleasant surprise. And we'll see after the surgery, which is going to be in a couple hours. I'll tell you how it goes. But the surgery will involve decompressing the spine and the spinal cord canal to fix that injury, because he was believed to be paralyzed because he had that spinal cord injury. So that's the first patient I saw. The second patient I saw was a gentleman who had suffered a stroke to the pons and medulla of the brain. Those are parts of the brain that deal with involuntary motions and movements of the body. So it controls your heartbeat and your breathing and your blood pressure, all vital involuntary motions of your body. And after reviewing the images and doing a physical assessment and examination, we determined that unfortunately this patient was not going to survive his injuries and he would never wake up. As a student of the neurosurgeon, I thought in the beginning, we can heal anyone that comes in, but this was kind of an eye-opener that you can't fix everyone, you can't treat everyone, and you can't you can treat everyone, but you can't fix everyone. And it was heartbreaking when we delivered the news to the family. We said, unfortunately, the likelihood is he will never wake up from his injuries or his illness. And we brought in the priest, and we brought in the rest of the family to say their goodbyes. And of course, they had as much time as they wanted with him before they removed the breathing tube. So that was the second patient I saw. Very sad, but eye-opening, and it was a good experience for me. The last patient I want to talk about, even though I saw a lot more, was a prisoner who came from the local prison. He had fractured his neck. He fell out of his bed, or his bunk, and somehow was able to fracture his neck and a bunch of bones in the neck and the spine. And it was kind of surreal to see. I've never been to prison. I've never seen anyone in prison. I've only watched TV shows about prison. So it was kind of surreal to see that in real life. Someone with handcuffs and leg cuffs, I think that's what you call them, I don't know. But he was chained to the bed. But that doesn't disturb us or derail us from giving them the best care. They're still people, they're still humans, they deserve top quality care. And that's why he was at the Level 1 Trauma Center, the neurological ICU unit, because he deserves care despite his downfalls. And most likely he's actually going to be going home instead of going back to the prison because of the severity of his injury. So I guess it's a win for him, and it's a win for us because we can fix his injuries. So you can say it's a win-win, I guess. That was the last patient I wanted to talk about. There are a couple more I saw, but those are the three most severe patients I saw and the three most interesting patients I saw. So that's why I wanted to share those with you. All right, everyone, I am heading to the operating room. We are about to perform the thoracic laminectomy of the patient who was in the motorcycle accident. It's going to be like a 3 to 4 hour surgery. We're also going to implant some screws and rods to stabilize the spine. I will let you know how it goes after surgery. All right, everyone, I thought I'd step outside for a little bit, get some fresh air. I just completed my first surgery ever. It was amazing. It was so surreal. First of all, when we flipped, there were some complications at first. When we flipped the patient and put his face facing downward and his back facing upward, because that's where the incision was going to be, he started to bleed pretty heavily out of his chest tubes, and we didn't know why. So we called the trauma surgeon in, and the trauma surgeon decided to resew the chest tube to the chest, to the inside of the chest. So that stopped the bleeding and fixed the blood pressure issue. So when the surgery began, it was, like I said, a spinal decompression or a thoracic laminectomy, and then putting those screws in to stabilize the spine. I didn't really do anything. I just stood there and watched. The surgeon was very kind in the fact that he step by step told me what he was doing. I looked at the x-rays. He showed me the x-rays, and because we were taking x-rays during the stabilization of the spine part, he was showing us x-rays every time he moved something, every time he put a screw in to make sure it's in the right spot. And, you know, he told me what the x-rays said and what they meant. So overall, graded for surgery. You know, he said, don't pass out. I said, I won't, and I didn't. You know, it was a major surgery, and I survived it. So this tells me, you know, I can do it. I can do it without getting too scared or emotional or upset or visually disturbed. You know, I think a lot of people struggle with that. They want to go into med school, but they get visually disturbed and they get too emotional about it. And while emotion is a big part of medicine, I think if you're too emotional about it, you tend to not give your patients the best care. And of course, if you get visually disturbed by blood and guts and insides of the body, medicine isn't career for you. So that's how first surgery went. I'm gonna go back upstairs. We're going to go see more patients, and then I'm done for the day. Hey everyone, I just stepped outside again, and I want to give you an update. I saw some consults from the emergency room. One woman who was 90 years old. She had a very severe stroke on the right hemisphere, so she had left side drooping and left side paralysis. Unfortunately, the stroke was pretty massive, and there was nothing surgically we could do about it. She has a 70 to 90% mortality expectancy. Again, we had to break that to the family, and they were very upset about it. You know, they were asking if there's anything else we can do, and we just can't. And like I said before, you know, we can't save everyone. That's just part of medicine. You can't save everyone, so that was really hard. Another loss, but hopefully the family can find some closure and move on. She was 90, so I'm sure she lived a full, healthy, and satisfying life. But it's always hard to see someone you love go. Last consult we got, and unfortunately this was a really severe injury that really tugged at my heartstrings a little bit. 17-year-old girl who had a severe traumatic brain injury, severe swelling and edema in the brain. You know, she needed a trach, and she wasn't responsive really that much. I'm gonna go watch the surgery tomorrow. They're doing craniotomy to relieve the pressure in the brain, and I'm gonna watch that. I'm only gonna do a video of the first day because I think the video is too long. Maybe I'll do a video for the second day as well. We're gonna see more patients, more surgeries. But today, you know, I saw some patients. Really hard to see some of these patients, you know, but especially the 17-year-old girl and that person, the male who had the stroke and his pons and medulla that ultimately ended his life. You know, these are all really hard things for me, and I never knew that there was so much loss in medicine, but it's part of it. You have to, you know, get through it, push through it, and know that you can't save everyone. So I'm heading home. I hope everyone had a good day, and I hope you enjoyed this video. If you want more videos like this, where I shout out more physicians, because I'm going to be shadowing more physicians, let me know, and have a good rest of your day, guys. Bye.